Countries in the European Union have so far vaccinated 15% of their joint population, but this has not stopped countries like Poland, Germany and France tightening their measures against the COVID-19 pandemic, with vast regions of France, including the capital Paris, now back in a total lockdown, and the country's leaders saying such drastic measures should have been taken much sooner.
Depuis le mois de janvier, nous avons opté.
Since the month of January, we opted to take measures different from those of our other European neighbors. And unlike most of those other countries, we did not impose a total lockdown on all of France. If anything, we continued to try and postpone the inevitable when we should have imposed it at the end of January. That was the right thing to do. And had we done that, the country would have been in a lockdown for probably 3 months. Many of the people we spoke to here in Rwanda do not understand how COVID is still a problem globally when vaccines are being administered left and right. We have always thought that a vaccine means the end of worrying about infection. Now we are being told that being vaccinated does not mean that you stop being careful, that you still have a 90% chance of infection. So that means you could still get sick despite being given the vaccine.
The most important fact is that when you get vaccinated, you think that you are immune from the disease. If then there must be a second dose, then they should administer it so that those who have been injected twice can have confidence that they are safe.
Health officials here in Rwanda have, however, repeatedly told people not to think that their vaccine somehow makes them immune to COVID. People may think that now that we have vaccines, it's the end of COVID, but that's not true. If anything, if you are not careful, the vaccine could be the reason people become complacent and COVID infections increase. The vaccines were never intended to stop people from getting and spreading COVID-19. They were created to address two problems: severe cases of the disease and fatalities. The two types of vaccines we are using here in Rwanda address those problems at a rate of 100%, meaning once properly administered, beneficiaries are no longer at risk of getting so sick from COVID that it could kill them. But they, by no means, protect you from catching the virus or giving it to a person who is not yet vaccinated and therefore far more vulnerable to its ravages than you are. Another thing, the vaccines become useful to the recipients 2 weeks after the second dose at the very least. We are currently in the first round of doses countrywide, and in most cases the second dose can only be administered a month after the first one, maybe more in some cases. Now factor in the 2-week wait after the second dose for your body to have produced enough antibodies, and that is quite a wait. So a person that got the first dose a few days or weeks ago is basically walking around with a vaccine that has not yet begun to be useful to them, which is why they must be careful so that that first dose does not end up becoming useless. The reason countries around the world, especially those in Europe, are now battling another wave of fresh infections stems from the COVID-19 variant first identified in the UK. Here in the country, those in the health sector have been carrying out research on the new strain, and the Rwanda Broadcasting Agency has learned that the results could be announced soon.